Hi, welcome again to my YouTube channel, Health.Faith.Fullness. I have a patient who is a brand new mom now living in Canada, and she was asking me tips about taking care of her newborn baby. Learn more information about immediate newborn care so you know what happens in the delivery room and until your baby is now ready for discharge. So if you are a new mom, like my patient, soon to be a mom, parents, and even grandparents who are as excited to take care of their new grandchild, other family members and caregivers that will take part in caring for this newborn, then please watch this video. I'm Dr. Mel. Stay tuned as I share to you my personal experience and medical expertise as a Board Certified Pediatrician of the Philippine Pediatric Society. Taking care of this tiny human being that looks so fragile is a big responsibility. But first, let me congratulate the new moms and dads, new mama and papa, or new tatay and nanay, or nana and tata in Ilocano, and the birth of your baby. The Essential Intrapartum Newborn Care Protocol, or EINC, that we follow in our hospital, Carmeli Clinic and Hospital, where most of the babies ICOTs are delivered, is called Unang Yakap or First Embrace, which is a campaign launched by the Department of Health in collaboration with the World Health Organization 11 years ago. These are 4-step, time-bound, and evidence-based interventions for both newborn babies and their mothers that ensure the best of care for both of them. If you look at it, there are just 4 simple steps that when done systematically will not only benefit the newborn but also the mother. So, here are the 4 steps. Number 1, the immediate and thorough drying of the baby. Drying the baby prevents heat loss from the skin and mucous membranes and ensures that the baby's temperature is maintained at 36.5 to 37.5 degrees centigrade and will also stimulate the baby to cry. Number 2 is early skin-to-skin contact. When the baby is placed in the chest of the mother, the skin-to-skin contact also prevents heat loss and at the same time initiate maternal-infant bonding and facilitates latching on and subsequent breastfeeding. Number 3 is delayed cord clamping. The importance of delayed cord clamping, which usually takes place 1 to 3 minutes, is that it decreases anemia, and among premature infants, it prevents intraventricular hemorrhage, which is bleeding in the brain of a premature. Number 4 is non-separation of mother and baby for early breastfeeding. Unang Yakap emphasizes the need to breastfeed within the first 60 to 90 minutes of life. It is during the early stage of breastfeeding when the protein and nutrient-rich colostrum is released. This gives the newborn baby protection against infections. I have a patient before, a teenage mom, and she was advised by her grandmother to discard this colostrum because they associate the yellow color into something infectious. So I'm glad now that moms are more informed and educated. They know that colostrum is the most nutritious food on earth and should never be thrown away. Vitamin K, eye prophylaxis, and immunizations like hepatitis B and BCG are given to your baby in the delivery room. Vitamin K is given to prevent bleeding diseases in the newborn. I'm glad that there are no more home-delivered babies because in the 1990s, we still see a lot of newborn babies dying of hemorrhagic disease which could have been prevented with vitamin K injection. at 24 hours of life. The tests being done are your newborn screening and hearing test. And by this time, the baby is now ready for discharge, especially if born by normal vaginal delivery. I do another complete physical examination and send your baby home when I can see that there is no yellowish color of the skin and on the eyes. There is no local infection on the eye, the skin, and in the umbilical area. And when there is adequate urine output, there is the passage of the greenish to blackish stools called meconium, which usually is for the first 3 days, and then when your baby is breastfeeding well. For CS deliveries, the discharge is a bit delayed, usually 4 to 8 to 72 hours, so the mother and baby diet can go home together when they are both stable. The different steps of EINC and its significance was extensively discussed. Moving on to my top 7 advice on newborn care. I feel that it's very important to talk about my first advice, which is hygienic care and safety tips for your baby, especially that SARS-CoV-2 infection has been a pandemic disease for the past 2 years. Newborn infants must never be exposed to anyone who is ill, no matter how minor the illness is. So, visitors should be limited, or better yet, no visitors allowed at this time. Proper hand washing protects the infants from potential infectious agents, and those handling the baby must remove all jewelries like rings, watch, and bracelet. Wash hands thoroughly. Dry with a clean towel, probably single-use towels, before touching the baby. Alcohol hand rub or sanitizers can be used as an alternative in cleaning the hand surface, including between the fingers and under the nails. I hope every one of us has already mastered the technique of proper hand washing as our number 1 defense from COVID infection, along with other healthcare protocols. My second advice is on cord care. For the cord care, there is no need to apply alcohol or any antiseptic in the cord stump. Leave it open, don't cover it so it dries up and falls off faster this way. If there are signs of infection around the cord, like redness and presence of discharge, the baby should be brought immediately to me. Just joking. Bring your baby to the nearest health facility. My patient in Canada was asking if it is normal if there's bleeding in the umbilicus of her baby and has not fall off by the 13th day. If this is the case, then antiseptic is needed to clean it because this might be a culture media for infection. The umbilical cord usually falls off within 7 to 10 days. Now we know that her baby's umbilical cord fall off is a little bit delayed. More cleaning is needed to remove the blood so that it will dry up faster too and eventually fall off. My third advice is to monitor the feeding, the frequency of urination, and bowel movement. I greatly encourage and support the new moms to go on exclusive breastfeeding. Breastfeed your baby every 2 to 3 hours or per the month. How will you know if your baby is full? Please comment down below and the one with correct answer will get a prize. I always advise the mom to be patient to breastfeed in sitting position even when you are sleepy at night, because there has been previous experience among my patients of developing aspiration when mom is breastfeeding lying down. In the first 2 days of life, you may observe that your baby may have only 1 to 2 wet diapers per day, and the color may be orange-red due to urate crystals. But once breast milk is adequate, the urine volume will increase to at least 4 to 6 diapers, wet diapers per day, and the urine color will become clear light yellow. Conium is the black stool colored stool which becomes greenish in 2 to 3 days and eventually becoming bright yellow. Stool consistency of breastfed infants is usually soft and yellow and sometimes liquid but does not overflow through the diaper. The frequency is often several times per day with a maximum of 7 times per day. My fourth advice is all about sleep and activity. Your newborn baby will be sleeping most of the time, around 16 to 20 hours per day, and it is preferable for your baby to sleep in their own crib. The crib should be kept free from any objects that may cause suffocation. The baby should be accessible always to the mother to sustain breastfeeding. Infants should never be exposed to direct sunlight. I usually advise mothers to just avail of the window sunlight. Are you aware that babies don't need to be fully bathed in the first few days of life? This is my fifth advice on bathing. Babies need to be kept dry and only soiled body parts like the diaper area and buttocks should be cleaned. Daily sponge bath with the use of a soft cloth to wipe the face, neck, and underarms is practical. When bathing, you should use only plain warm water and ensure that the room is warm and drop-free. Use mild soap without additives. The use of lotion, powder, or shampoo and cologne is not recommended. Genital care is as important to prevent urinary tract infection. Using warm water, gently wash the genitalia of your newborn baby girl. Cleaning motions should be directed away from the genitalia, from the top to bottom, and not the other way around. For newborn boys, the uncircumcised penis may be cleaned with warm water while gently retracting foreskin. Routine circumcision is not recommended, but if the parents insist, then circumcision can be done. My seventh advice is about the other concerns of most moms. And here are the questions they would usually ask me. Is it necessary to give water to my newborn? My advice is that water is not necessary at this time because the breast milk is adequate for the first 2 months. I would only advise to give water if there's a problem on constipation. Another question, is applying acetate de manzanilla safe for my baby? Actually, it's a no-no. As a requirement when I became a fellow of the Philippine Pediatric Society, I did a research paper entitled Maternal Caregiver Attitude and Practices Uncommonly Used Home Remedy for Abdominal Complaints, and the result of my study showed that most mothers and caregivers, about 99%, would apply acetate de manzanilla as a common remedy for colic, for gas pain, and other burping problems of their babies. This is done routinely and is not a good practice. Camphor is the compound present in acetate de manzanilla. It has a pungent aromatic odor. And do you know that acetate means acid? So, applying camphor excessively and vigorously may cause skin irritation. On my extensive literature review, I came across on studies that camphor may be a common yet unrecognized source of seizures in children. So the use of acetate de manzanilla is not recommended. Another question from my patient in Canada, will my food intake affect my baby and cause her stools to be loose? Generally, mother's food intake should not affect baby's stools. Try to observe so you know what to avoid in case your baby develop loose stools. Personally, when my children were babies, they will develop loose stools when I eat a lot of chocolate. That is a local chocolate, which is my favorite since I was young. But if I decrease it to once a day, then they will improve. There are many beliefs, customs, and traditions that has been handed down from generation to generation, some of which are putting bracelet on their babies and putting salt and garlic nearby to drive away bad spirits. But for me, it has been my practice to put a Bible near my children when they were still babies, and I still do it now that they are grown up. If you still have other questions, please comment down below and I'll try to answer all of them. Having a baby is one of the most exciting yet intimidating human experience you might ever go through. I hope you will find my top 7 advice on newborn care useful. Congratulations, Mom and Dad! You have to look forward and your life is about to change permanently. Enjoy taking care of your babies! Please like, subscribe, comment down below, and share to your family and friends. May God bless you always, Kitlin Vasha and Fain Athena and your parents. Thank you for sharing your beautiful pictures. See you in the next videos.